Money FM 89.3, best of breakfast. Mind your business, only on Money FM 89.3.
Good morning and welcome to Mind Your Business. I'm Imad Akhtar. Every day, radiologists across the world read thousands of scans, catching everything from fractures to life-threatening diseases. It's a high-stakes job, often done under intense pressure. But AI is stepping in as a powerful second set of eyes, and here in Singapore, that future is here. Parkway Radiology, Singapore's leading private diagnostic imaging provider, is rolling out the country's first large-scale deployment of a comprehensive radiology AI solution. Developed by Australian health tech innovator Annalise.ai, this system will be integrated across Parkway's entire network, transforming care for over 85,000 patients a year. It's a major step for healthcare innovation in the region, and today we're speaking with the leaders behind it. So let's welcome on the show first Ms. Tan Yujuan, CEO of Parkway Radiology and Parkway MediCentre. Good morning.
Good morning. Thank you very much for having me on the show.
You're very welcome. And she's joined by Dr. Aengus Tran, co-founder and CEO of Annalise. Good morning, Dr. Tran.
Thank you for having me part of the show.
All right, you're very welcome. Let's start with Ms. Tan. How would you describe the current state of private healthcare in Singapore, especially in terms of diagnostic services and patient expectations?
Well, private healthcare in Singapore has become increasingly competitive, and our patients at the same time have been having increasingly high expectations in terms of patient experiences and patient outcomes. Patients are generally way more informed these days, so we got to make sure we stay ahead of the curve, to meet their expectations. Also, I guess patients' needs are also getting more complex due to the disease patterns globally. So there's a need for more coordinated care and personalized approaches when it comes to treating patients.
Okay, Dr. Tran, let's bring you into the conversation. Now, the definition of digital health is ever evolving. The era spurred on by the pandemic is giving way to one now defined by AI, and solutions that strengthen the bond between healthcare professionals and patients in an integrated manner. From your perspective as both a doctor and an AI engineer, how do you see the global healthcare landscape evolving with the rise of AI and digital health tools? What's the role of AI in reshaping healthcare?
I perceive, one of the biggest challenge of healthcare and diagnostic radiology globally is one of capacity, right? So in Singapore, we only have 469 radiologists to provide a diagnostic service for the entire country. And that means that everyday person, you're waiting much longer to get those results interpret and deliver, which often contain life-saving diagnosis and therefore unlocking treatment. But radiologists also working harder than ever, right? Maybe a couple of years ago, we would have 5 to 10 minutes to read each of the chest x-ray. And now that is because of the capacity constraint and the rising volume, as Ms. Tan articulated, we're seeing radiologists having to spend much less time per case. And that really required them to get that support from AI as a second set of eyes to increase the level of diagnostic confidence and ultimately better outcome for patients through increased diagnostic accuracy and also earlier time to critical results. So that's one of the key things that AI will play a role in the evolving landscape of healthcare.
Based on the testing you've done so far, what is the diagnostic accuracy rate of AI versus the human eye?
It's really depending on their different diagnosis, right? So we know that when radiologists looking at chest x-ray, there are hundreds of conditions that they need to instantly be able to detect, be it fractures or lung cancer and other illness such as lung infections. One of the biggest challenges that a radiologist face is what we call satisfaction of search. So perhaps there's a very obvious lesion that they instantly see, such as infections of the lung, but perhaps hidden behind the collarbone is a subtle lung cancer that they have overlooked. Now, we are only human, right? So we're easy to be distracted by very obvious thing and not seeing the more subtle thing that's hidden in plain sight. So we see AI making a biggest difference there because the AI has no bias, right? Looking at every scan and every diagnosis, it with equal attention. And that you really complement that human in the loop where the radiologist will act as the final decision point and bring that clinical expertise to the table while AI acting as a trusted second opinion, checking for hundreds of other conditions that may be relevant in any given case. So that's how we're going to really seeing AI accelerating the diagnostic accuracy. At the same time, we're also seeing earlier time to diagnosis. It's funny to say this, but radiologists are human, but they need to go to sleep at night, right? And oftentimes, patient could show up at night in emergency room with critical conditions, and that's typically when we have the least amount of coverage. So one of the things that AI can do is to pre-screen on this X-ray well ahead of time. And if there's a critical condition, then alert that to the treating physician, even when the radiologists perhaps are not immediately available. So in those instances, it's not really about a more accurate diagnosis. It's a matter of getting a diagnosis at all in a timely manner.
Ms. Tran, Dr. Tran has just explained some of the key benefits that AI can bring to the table in the radiology landscape. What would you say are some of the biggest pressures facing Singapore's private healthcare sector right now, especially when it comes to diagnostics? Is there any kind of pushback or skepticism in relation to bringing AI to the fore? And perhaps maybe some of the bigger inefficiencies that you feel AI could help with?
Yeah, thanks for that. Dr. Tran described it very well. I think some of the key challenges involve the management of resources from radiologists to radiographers and ensuring that we manage the costs while delivering increasingly high quality care. There has been a growing demand in diagnostics year on year due to chronic disease, aging population, and more awareness of preventive health. So that against the climate of having finite resources makes it even more important for us to leverage on the right tools and technologies to ensure that our team can be very as productive as possible. In terms of how AI has helped us and how I see it can continue to help in this manner, certainly the deployment of the Chess AI solution has been an eye-opener for us and how it can really speed up the way and the turnaround time of our reports. And in those instances where Aengus has mentioned, in the middle of the night or, when there's a need to detect a subtle critical finding urgently, we've really seen it being a great tireless second reader for us to really help the radiologists and the care providers deliver timely care to the patients.
Okay, Dr. Tran, coming back to you, Annalise was founded back in 2019, so about 6 years now it's been operational. Can you share some real-world clinical examples of how beneficial it's been to patients?
Yeah, definitely. I would start with lung cancer, right? So we know that lung cancer is one of the biggest cause of cancer death in the world, and early diagnosis of these conditions are critical. For instance, if we were to pick up cancer at stage 1, we know that 5-year survival rate is up to 75%, right? So very good survival rate. But unfortunately, if this cancer diagnosis at stage 4, then we're looking at single-digit survival rate over 5 years. So early diagnosis and prevention is open up a lot more options for advanced treatment, something that Parkway is going to be delivering. So the question is, how do we make this happen? And that's where our AI come in. Our chest X-ray AI solution can, as I mentioned, detect 124 different conditions. And of course, part of that, detections of early lung cancer. And we've seen data that our AI can pick up a lung cancer up to 10.5 months sooner than it would have otherwise been picked up if it were just going through a routine care pathway. That means over 2 stages earlier. Because the AI, like I said, is comprehensively reviewing this X-ray and picking up this subtle early pattern of these conditions. And that play a huge role in enabling the radiologist to get the patient through the right diagnostic pathway and ultimately treatments that they desperately need. So that's one example of how we're really fast-tracking diagnosis and improving patient outcome. The other example are the second pairs of eye for doctors. Hospital is a place where quality and safety are paramount, and there's a lot of procedures that need to be in place to make sure that, for example, when a patient feeding tube is being put in, that is in the right place, right? That we are putting food into the stomach and not the lung, for example. And our AI is acting as that safety net, that safeguard to ensure that the clinicians getting the critical insight they need to make keep the patient safe within hospital in a timely manner. So those are two examples that we're seeing user benefiting the most from using technology from Annalise.ai.
Yeah, thank you for that. Ms. Tan, just citing the two examples that Dr. Tran has mentioned, to what extent does this AI rollout support Parkway's goals around patient outcomes, for instance? And in terms of cost, is that something that is weighing on patients' minds?
So our vision, of course, is to be a very trusted healthcare provider, right? When patients come to us, they should get the care they deserve. So what Dr. Tran was mentioning, in our context, we do a wide range of exams. Even though we do 85,000 chest x-rays a year, the reasons for the exams vary broadly, from a regular screening all the way to checking the placement of a feeding tube. So Annalise was very appropriate for us because of their wide range of findings they could detect. So in our context, whether it's a chronic patient or complex ICU patient, we were able to use the same software to address the different needs that the different chest x-rays were trying, the questions the different chest x-rays were trying to answer. So that was why we really found that Annalise was the right partner for us. In terms of cost, when we adopt AI, of course, there's cost of implementation, but we don't pass this cost on to the patients. So for a patient, they actually benefit from getting this AI-backed service without paying anything extra. For us, we see the value in the increased diagnostic confidence, as well as overall, in the long run, a reduction in cost by being way more efficient.
All right. Dr. Tran, how do you ensure that this tech is safe and clinically validated? What are some of the guardrails in place to ensure the AI is ethical, secure, and, like I said, clinically validated?
Yeah, thank you. I mean, we very value the partnership with Parkway, and as an organization, we are clinician-led. Myself is a doctor, and a big part of the leadership team are also clinicians, or if not radiologists. Therefore, clinical validation is something that is built into the very culture of the company. The way we look at this is the partnership with health provider to validate this tool in the field, but we're also doing a lot of pre-market testing to ensure that the tool is accurate. In our mind, the non-negotiable bar of performance is the radiologist's current status quo. So we conduct really extensive clinical study to establish what is the accuracy rate of an expert radiologist in any given diagnosis. For example, fractures, pneumothorax, or lung cancer, for instance. And when we test our AI, we want to ensure that the algorithm performs at or above that level in order for that to be a safe and effective tool for those clinicians to use. So far, we published in Lancet Digital Health and other prestigious journal, and the result shows that the algorithm, when used with the radiologist, produce significantly higher accuracy in detections. And therefore, we are very confident about the safety and efficacy of the tool. Once we deploy in Parkway, for instance, we also partner closely with our customer success team to really go in and survey the experience of the radiologist, and also collecting analytics data on false positive and false negative rate to really tune the algorithm for the optimal performance, specifically for Parkway and the population mix in Singapore itself. So it's a pre-market, but also an iterative process that we go through all the time to ensure highest accuracy possible.
All right. We have been speaking about Parkway Radiology's partnership with Australian health tech innovator Annalise, which is improving the speed and efficiency of diagnostic imaging. This partnership may as well set a new benchmark for what patients can expect from private healthcare in Singapore. I'd like to give a big thank you to Ms. Tan Yujuan, CEO of Parkway Radiology and Parkway MediCentre, as well as Dr. Aengus Tran, co-founder and CEO of Annalise.ai, for your time and insights this morning.
Thank you.
Thank you for having us.
Thanks. Have a great day. Stay with Money FM 89.3.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.